Hi everyone, welcome back to your channel I Love Pharmacology, and in this session let us see which are all the pharmacological questions which are asked in INICET May 2024 Pharmacology Recall session. So the questions which were asked were, which among the following anti-leprosy drugs can cause skin hyperpigmentation? The options were clofazimine, rifampicin, dapsone and the ofloxacin. So what could be the answer? Here the answer is, don't confuse with the rifampicin, because rifampicin is more commonly known to cause reddish orangish discoloration. Basically the secretions in the body will turn into orangish reddish color discoloration. Even though it can cause skin pigmentation, the most common is the reddish orange discoloration. So here the classical answer is the clofazimine, which is an anti-leprotic drug which causes ichthyosis as well as discoloration of the skin, eyes and the bodily secretion. And also the clofazimine is responsible for crystal deposition throughout the intestinal mucosa, and also it can prolong the QT interval and cause arrhythmias. And whereas the rifampicin causes harmless reddish orange discoloration of the skin, urine, feces, as well as the saliva, tears, and the contact lenses. But the hyperpigmentation or discoloration of the skin is seen with the clofazimine. So answer is the clofazimine here. Next, coming to the question. So which among the following is a ER1 inhibitor? So please remember we have an option like panitumab, risutinib, and alcitinib, and the loraltinib. So please remember the antibody inhibitors of the epidermal growth factor receptors are, we have cetuximab, panitumumab, and the nesitumumab. So basically they are used in the treatment of colon cancers as well as the non-small cell carcinoma. So how to differentiate between HER1 inhibitor and HER2 inhibitor? So HER can be classified into HER1 as well as human epidermal receptors 1 and 2. So HER1 will act on the epidermal growth factor receptor 2, whereas HER2 acts on epidermal growth factor receptor 1. And epidermal growth factor receptors, drugs targeting the EGFR2 are used in the treatment of non-small cell lung carcinoma, and whereas the HER2 targeted drugs are used in breast cancers. The example for the HER1 inhibitor targeting the EGFR2 which are useful in lung cancer is the cetuximab, panitumab and the nesitumab. And to treat breast cancer, we have trastuzumab and pertuzumab. So here the answer will be your panitumab. So coming to the intermittent next question, that is intermittent injection of teriparatide, which was used for osteoporosis, can cause which of the following side effects? So the options were osteonecrosis of the jaw, osteosarcoma, subtrochanteric femur fracture, and the loss of bone mass. So please remember teriparatide has got very important side effects, like it can, since it increases the bone mass, bone deposition is increased. So which is a parathyroid hormone. It can cause hypercalcemia, it can cause renal stones, that is nephrolithiasis, and it also elevate the serum uric acid levels, and it can cause osteosarcoma. So there is an increased risk of osteosarcoma, and there is a black box warning which was given, and teriparatide should not be used more than in case more than 2 years, and also they are contraindicated or avoided in case of Paget disease as well as in those where there is a elevated alkaline phosphate because of the increased risk of osteosarcoma. And there is one more drug with the teriparatide, that is abaloparatide, which commonly causes orthostatic hypotension. So here the answer will be the osteosarcoma. And please remember, osteonecrosis of the jaw as well as subtrochanteric femur fracture is seen with respect to the bisphosphonates. And loss of bone mass is not a characteristic feature of the teriparatide, where teriparatide will increase the bone mass deposition. The next question is the PCSK9 inhibitor useful in lowering the cholesterol is. So please remember we have a PCSK9 inhibitors like ivalucumab and alerucumab. So you need to see for the locumab. Locumab means lowering the cholesterol levels. So here the answer will be ivalucumab. Ivalucumab. So basically PCSK stands for pro-protein convertase subtilisin Gixin 9 inhibitor, whereas STMIB is a NPC1L1 inhibitor, that is Niemann-Pick C1 like 1, whereas Tori-Citrapib is a CETP inhibitor, that is a cholesterol ester transfer protein inhibitor, and Lomepapide is a MTP inhibitor, which is a microsomal or triglyceride transfer protein inhibitor. So coming to the next question, for treating the enterococcal infection in a patient who are allergic to the penicillin, which of the following is given? So whenever the patient has got allergic to penicillin, so one must avoid using the piperacillin as well as the ceftriaxone and also the aztreonam, because they belongs to the bacterial cell wall or synthesis inhibitor group. So please remember from the Goodman and Gilman, it says that aztreonam has the activity only against the gram-negative bacteria, and it has no activity against the gram-positive bacteria and the anaerobic organisms. So they have got good activity against the pseudomonal infection and excellent activity against the H. influenza, Proteus, E. coli, and the Klebsiella serratia. So please remember here, whenever the patient is allergic to the penicillin, you need to avoid giving the piperacillin, ceftriaxone as well as the vancomycin, because all they belongs to similar group of drug which can cross sensitivity reaction. Cross sensitivity reaction exists with the piperacillin, ceftriaxone, and the vancomycin. So here the aztreonam has got activity only on gram negative bacteria, and it has no activity on the gram positive bacteria and anaerobic organisms. Anaerobic organisms. That's why the answer will be the aztreonam. So next, coming to the antidiabetic drug useful for treating heart failure with a low ejection fraction. So option is dapagliflozin, liraglutide, pramlintide, and the metformin. So please remember the antidiabetic drug which are useful in the heart failure or SGLT2 inhibitors like dapagliflozin, empagliflozin, and the sotagliflozin. So answer will be your dapagliflozin. So which is the anti-diabetic drug which can cause urinary tract infection? So please remember those drugs which are excreting the glucose from the urine or responsible for the urinary tract infection. So please remember the more commonly the UTI is seen with the sodium glucose transporter 2 inhibitor, that is SGLT2 inhibitor. The example is the dapagliflozin. So anti-diabetic drug which causes weight loss. So please remember here the drugs which can cause the weight loss is seen with the drugs like the pramlintide, GLP-1 agonist, SGLT2 inhibitors, and the metformin. So here the answer will be you can go with dapagliflozin, or if the option were to mention metformin, you can go with the metformin. So next question is oral antidiabetic drug which causes the unexplained diarrhea. So please remember here the most common cause for diarrhea is the metformin. So metformin can cause nausea, diarrhea, indigestion, as well as vitamin D deficiency, and also they are more prone for lactic acidosis, especially in the individuals who are having a kidney insufficiency or liver failure or cardiorespiratory insufficiency, as well as in the chronic alcoholism. So glimepiride is most commonly will have hypoglycemia as the side effect, whereas pioglitazone has got fluid retention as a side effect, and dapagliflozin, as we discussed earlier, which is a SGLT2 inhibitor, they are more prone for urinary tract infection as well as external genitalia ulcers as well as the Warner's gangrene. And also the sitagliptin is known to cause upper respiratory tract infections. So next, coming to the false statement about the voriconazole. Voriconazole. So please remember, so voriconazole false statement, it's high fatty meal will going to reduce the voriconazole bioavailability, and it should be given orally 1 hour before, or either 1 hour before or 1 hour after the meals. So since fatty meal reduces the absorption, it has to be taken in the empty stomach, which is a true statement. So not given with pyrazinamide, yes. This pyrazinamide can cause the enzymatic activity, and they inhibit there can be drug interaction associated with the oroconazole. So not given with pyrazinamide will also be the right option. So loading dose is given. Yes, it is. The loading dose can be given with voriconazole and needs therapeutic drug monitoring. Yes, voriconazole, especially in case of children, require a therapeutic monitoring, especially in case of children. So here the false, there is no false statement as such. If you have any option that can be put into this question, please type it in the chat box. So next, coming to the diuretic name and the site of action, which is the match the following type of question. So please remember, mannitol we have furosemide and spironolactone. Mannitol is osmotic diuretic, furosemide is a penicillin diuretic, and spironolactone is a potassium sparing diuretic. So please remember, usually the carbonic anhydrase inhibitor like acetazolamide will act on the proximal convoluted tubule. Furosemide act on the thick ascending loop of Henle. Thiazides act on the distal convoluted tubule, whereas potassium sparing diuretics will act on the collecting tubule, and mannitol will act on the proximal convoluted tubule as well as the descending loop of Henle. So here the mannitol will have an option for both, like the loop of Henle, since they are not specified whether it's ascending or the descending. You can go for loop of Henle as well as the PCT. Multiple option answer exists here, and furosemide will act on the loop of Henle, and spironolactone will act on the collecting tubule. The next is the drugs which are useful in cyanide poisoning. So please remember, in cyanide poisoning, what happens is hemoglobin is converted to methemoglobin, and methemoglobin will going to attract the cyanide, which will going to attack the cytochrome oxidation process. Thereby, what happens is the hemoglobin when converted into the methemoglobin. How hemoglobin will be converted into methemoglobin? Whenever you give a sodium nitrate or the amyl nitrate, the hemoglobin gets converted into the methemoglobin, and methemoglobin will going to attract the cyanide molecule, and next methemoglobin along with the cyanide moiety, you will going to give sodium thiosulfate, which is helpful in excretion of the cyanide from the body. So drugs which are useful in cyanide poisoning, here you have got multiple correct answers like sodium nitrate, amyl nitrate, and the sodium thiosulfate. GTNA is used in case of angina. So cyanide antidote kit, we have amyl nitrate, sodium thiosulfate, and also you can use hydroxycobalamin, that is vitamin B12. The next question is, the male with fever, cough with white tenacious sputum, which is the true statement. So please remember here, the codeine and dextromethorphan, they are the antitussive agent. Means they are basically used in the dry cough. They are also called as cough suppressant. So here we can rule out the codeine. Dextromethorphan can be ruled out, and even both dextromethorphan plus bromoxane can be ruled out. Since the patient has got white tenacious thick sputum, you need to thin the sputum. So it can be done by bromoxane. So bromoxane to thin out the sputum is the correct answer. So codeine is an antitussive, which is a cough suppressant, preferable for dry cough, and dextromethorphan is an NMDA blocker as well as central antitussive, and which is a cough suppressant again, which are useful in dry cough. The next question is, a 30-year-old female with chronic hypertension with the headache. Which of the following is not used in the postpartum hemorrhage? So please remember, the postpartum hemorrhage, we can use the oxytocin, misoprostol, as well as the carboprost, which is again a prostaglandin analog. But since the patient has got chronic hypertension, if you are using a methyl ergometrin, it is a most very potent vasoconstrictor which can aggravate the symptoms of hypertension, and it can elevate or worsen the blood pressure. So here you need to avoid usage of the methyl ergometrin, which is a powerful vasoconstrictor. So next is the anticoagulant, which needs the monitoring. So please remember, enoxaparin doesn't require, usually the low molecular weight heparin does not require any monitoring, laboratory monitoring, but the unfractionized heparin, Unfractionized heparin requires monitoring of APTT, but low molecular weight heparin does not require, except for in case of the renal failure or individuals or renal insufficiency, they need to have a monitoring of the anti-factor 10A. Enoxaparin does not require any monitoring. What about the dabigatran, which is a orally given? Orally it does not require, but oral warfarin, if it is given, it requires a monitoring. So fondaparinux does not require a monitoring, but lepidolin definitely requires a APTT monitoring. So heparin, which is an unfractionized heparin, requires APTT monitoring, whereas low molecular weight, there is no need for the monitoring. But whenever, since it is excreted through renal route, in a patient with renal failure, you require to monitor anti-factor 10A. So lepidolin is the answer here, which requires monitoring of creatinine as well as the APTT, whereas other anticoagulant does not require monitoring. So next question is cannabidiol is not given in. So cannabidiol can be given in case of Dravet syndrome, tuberous sclerosis complex, and Lennox-Gastaut syndrome. Here the answer is it is not preferred in case of Rett syndrome. So in Rett syndrome, the FDA approved drug is the trofinetide. Trofinetide. Please remember it is the trofinetide. So next question is which of the following is So next we have a question that is which of the following is useful for quick reversal of vecuronium. So option is glycopyrrolate, neostigmine, edrophonium and sugama dex. Edrophonium is used to differentiate between the cholinergic crisis and the myasthenia gravis. So it cannot be glycopyrrolate, it can be of neostigmine or sugama dex. So neostigmine is preferable for reversal of the D-tubocurarin, whereas the sugammadex is specifically used to reverse the skeletal muscle relaxant effect or the overdose due to vecuronium as well as the rocuronium. So please remember here the answer will be your sugama dex for the quick reversal of the vecuronium or the rocuronium. So basically these drugs will going to reverse the skeletal muscle activity. Skeletal muscle activity or skeletal muscle paralysis can be overcome by this vecuronium. So along with this vecuronium as well as neostigmine, to overcome the effect of uh, 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 the muscarinic activity, you need to also give the atropine. Since acetylcholine act on muscarinic receptor and nicotinic receptor, atropine will block the muscarinic receptors, whereas nicotinic receptors can be overcome by the neostigmine or the sugama dex. So please remember to reverse the actions of the D-tubocurarin, you give the neostigmine, which is anticholinesterase. For vecuronium and rocuronium, you need to give a sugamadex, which reverses the skeletal muscle paralysis. The answer here. So, which is a suicidal inhibitor? The options we did not find. The suicidal inhibitor can be of your pantoprazole or the PPIs or the beta lactamase as such. So, suicide inhibitors, they are the one which inhibit the enzyme irreversibly, and they are also called as hit and run drugs. So which is the most potent estrogen? Whether it is estradiol, estriol, estrone, and the conjugated estrogen. So please remember the most potent estrogen will be your estradiol and estriol will be your weakest estrogen. The next question is the inhaled nitric oxide is used in the treatment of. So it is a direct question. So they are useful in the treatment of persistent pulmonary arterial hypertension. So basically nitric oxide will going to cause vasodilation of the pulmonary arteries. So coming to the next question, which is the drug which reduces the mortality in chronic kidney disease patient? So here the option is phenerinon, AR-based SGLT2 inhibitor and thiazides. The answer here is the phenerinon, which is the mineralocorticoid receptor antagonist. So phenerinon is a diuretic, which is a mineralocorticoid receptor antagonist, which are used to prevent the CKD in diabetic kidney disease individuals. So this were the some of the questions which were asked in the NSCT May 2024 from the pharmacology topics. So if you know any of the questions which were asked or left out, or if there were any different options as well as different pattern of the questions, please comment it in the chat box and we'll try to get the answer in as early as possible. Thank you and all the best.